Hello, my name is Geraldine Summers. This is my head-to-toe video assessment for healthcare, my health assessment class. Sam has been gracious to be our participant for tonight. Prior to Sam coming into our room, his blood pressure, temperature, pulse, and respirations were obtained, and all within normal limits. His height and weight was obtained also, and his BMI calculated. Sam was asked to empty his bladder. Sam, have you emptied your bladder?
Yes.
Okay. This will be our start of our presentation. Okay. Prior to coming into the room, I've also washed my hands. All right, Samuel, I'm just going to look at your head. Lesions, rashes, masses, eyes, eyebrows, eyelashes intact, nose, mouth, ears, and eyes are in symmetry of his face. Okay. We're going to start with your frontal. This is your frontal bone, along with your frontal sinuses. Any pain?
No.
Okay. We're going to go to the temporal area, his parietal area, and the occipital area in the back. Hair is smooth. If he was a coarse, it would be a condition called hyperthyroid. Fine hair would be hyperthyroidism, which he has neither. His auricles are both without masses. Ethmoid sinuses, phrenoid sinuses, maxillary sinuses, zygomatic bones, which is cheekbones, maxilla, which is upper jaw, and mandibular, which is his lower jaw. Okay. Testing for his temporomandibular joint. I'm going to ask Sam to open his mouth and close it. Clicking and popping signs are not unusual. Go ahead and open your jaw and wiggle it to side. Any pain or tenderness?
No.
Okay. And while I'm on his face, I'm going to go over his lymph nodes. And we're going to go with the pre-auricle, post-auricle, occipital, templar, submandible, submental. We're going to go down to his neck and touch the anterior superficial chain with the deep chain also, posterior, supraclavicular, no tenderness. Okay. No. We're going to also go for his axillary nodes. Okay. No tenderness under there?
No.
Okay, now we're going to start asking Sam to wrinkle his forehead, squeeze his eyes, okay. Clench his teeth, smile, and puff out his cheeks. Okay. We're testing some we're testing some cranial nerves, 3, ocular motor, 4 is trochlear, 5 is trigeminal, 6 is abducens, and 7 is facial. Okay, Sam, I'm going to have you puff out your cheeks once more, but I want you to stick your tongue in one side of the cheek, and I'm going to try to put some resistance to it. So we're testing your muscles of your tongue. Go ahead and do. Okay, great. Now I'm going to also put my hand on the side of your face, and I'm going to have you do a resistance for your neck resistance. Push, 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 great. And the opposite side, push, push, great. Jugular veins is no distension. We're going to come to the eyes, and I'm going to do a near vision sight test, which with the Rosenbaum chart, okay, for testing the ocular motor nerve 2. Go ahead and read the lowest line for me, Sam.
9157300X.
Okay, great. And we're going to go to the cover up test. We're going to cover one eye, looking at each eye after I move the cover away, looking for some conversion. Okay. We're going to do the 6 corner fields of vision for any extraocular eye movements. And I'm going to put my finger up, and I just want you to concentrate on my finger without moving your head. And we're going to start in the center, going to the lateral, up to the left, down to the left, back through the center, up to the right, down to the right, back into the center. Great. Problem there. I'm going to test also cranial nerve 5 while I'm here. I'm going to have you close your eyes, and I'm going to be touching part of your skin, and let me know if you feel a smooth or sharp.
Smooth. Smooth. Sharp. Sharp.
Good. As we're on the cranial nerves, I'm going to have him also do cranial nerve 1, which is olfactory. Please close your eyes, and I'm going to be passing some items under your nose, and let me know if you can smell them. And what do you smell?
Lemon.
Okay. Again.
Peppermint.
Oh. I'm going to look in your, look in your eye. We're looking for the red light reflex. Reflex, I'm sorry. Then we're going to be looking into your ears. And we want to look at the tympanic membrane for pearly grays. We're looking for the umbum, the handle of Malus, and the light reflex. We're going to be pulling your auricle up and back. Great. And the same thing here. Pulling it up and back. We're looking in. Now we're going to be doing a whisper test, and I'm going to be whispering an item in your ear as you cover the other ear.
Hot dog.
Okay, now cover the opposite ear.
Pizza.
Okay. The next we're going to test for the acoustic nerve 8, and I'm going to put this tuning fork, it's called, on top of your head, and I need to know if you're equal balance or one ear versus the other.
It's the same on each side.
Okay. Okay, and that was the Weber test. I'm going to also do the Rhine test, which is putting doing a bone air conduction. I'm going to put it in the occipital bone area, and let me know when you cannot hear it.
Now.
Okay. Versus the ear conduction, let me know when you can't hear it anymore.
Now.
Okay, great. Air conduction is longer than bone conduction, and we would also test the other ear. Okay, looking into your mouth. His lips are without any cracks. They're pink. Go ahead and open your mouth for me. Okay. His buccal-mucosa is pink and glistening and moist. Can you lift up your tongue? No masses noted on the floor of the mouth or the roof. No redness. Okay. I'm going to be testing for cranial nerves 9 and 10. 9 is glossopharyngeal, and 10 is vagus. And I'm going to ask Sam to say, ah.
Ah.
I see the uvula, the tonsillar, the anterior and posterior pillars, and the posterior pharynx. Okay, great. And that's testing cranial nerves 9 and 10. Also, I'm going to inspect his teeth. Go ahead and open your mouth. And the gums. His teeth. Okay. Okay, great. Okay. Nasal bone, septum area is in symmetry with his face. I'm going to look in your nose for your mucosa, your turbinates, and your septum, making sure all are without masses. Your head. Great. Okay. No drainage. Okay, next we're going to make sure your trachea is in line. Okay. And I'm going to walk behind you and check out your thyroid. Okay. I'm going to ask you to swallow. Thyroid's freely movable. Okay. And I'm going to feel one carotid at a time. You wouldn't want to do both at the same time. You wouldn't want to cheat your oxygen level to your brain. Now I'm going to listen. Okay. One side at a time. Deep breath in and hold. Okay. And breathe out. Take a deep breath in and hold. Checking for the thyroid. Okay. Okay. Let it out. I'm going to take one more deep in and hold. And let it out. Great. Great. Okay. Going down to your arms. Muscle tone, temperature, color, okay. Nail beds, pink, smooth, little convex to them. Go ahead and I'm going to have you do your fingers. And we're looking for a clubbing for any diseases in there, okay? Respiratory diseases. I'm going to be checking your brachial artery. Your radial. Brachial. Okay. Okay, now I'm going to be testing some other cranial nerve, number 11, for spinal accessories. I'm going to have you shrug your shoulders. Any pain, tenderness?
No.
Okay. And I'm going to add some resistance to that. Ooh, great, nice and strong. Okay. Then I'm going to ask you to tip your head back and forward, from side to side. Any pain? Nothing in your
No.
neck. Okay, great. All right. Next, we're going to go to your back. We're going to be looking in your back. Same thing, skin, lashes, lesions, masses, anything noted. I'm going to feel. No pain?
No.
Okay. Okay. I'm going to ask Sam to take a nice deep breath for me and hold it. We're looking for the diaphragm excursion. Okay, release it. I'm going to mark this area. Then I'm going to have you take another deep breath in and push it out, and hold. Okay. And we're going to be measuring these two measurements, and it should be 3 to 5 centimeters. Okay, great. Next, I'm going to be feeling for his thoracic expansion, making sure that there's no overly expanding. And then I'm going to be percussing the costovertebral angle, which is part of the kidney. And Sam, let me know if you feel any pain. Any pain?
No.
Okay. Now I'm going to take a listen. Before that, I'm going to do the feeling, and I'm going to ask you to say 99 a couple of times for me. And we're going to be testing for the tactile fermenters. Go ahead and say 99.
99.
Again.
99.
Okay, and that's the test for the evaluation. Okay, now we're going to listen. We're going to go from side to side. Deep breath in and out. Now we're going to go to the lateral. Deep breath. And again over here. Again over here. Okay, great, great, no problems there. All right, go ahead and put your shirt down. And I'm going to be inspecting we're going to do your upper chest. Okay. We're looking. Okay. No rashes, lesions, masses noted. We're going to be doing the precordium for any thrills, heaves, or pulsations. I'm going to be putting my hand under the apex of the heart. Going to the left sternal border and at the base of the heart. None is noted. Okay. Just do a little percussing. Any pain?
No.
Okay. Going to listen to your lungs. And again from side to side. Now I'm going to be listening to your heart sounds. We're going to be looking into the aortic, pulmonic, herbs, tricuspid, and the mitral. Great. All with that. Okay. Okay, go ahead and I'm going to ask you to stand up for me. And we're going to be testing your lumbar spine. Go ahead and have it bend over, touch your toes for me. Any pain?
No.
This is where we're going to check out the spine too to make sure it's all no scoliosis, no. Go ahead, stand up. And I'm going to have you turn side to side for me. Okay, great. Okay. Any pain?
No.
Okay,
No
I'm
pain.
going to have you lay back down. And I'm going to go to your abdomen. All right. Now we're going to check out your abdomen. We're just going to look first, making sure it's smooth, respirations are even. I'm going to have you take a nice deep breath and hold it. Looking for any pulsations, which is good. Okay, great. Let it out. Okay. Now I'm going to go ahead and now listen to all four quadrants. Okay, I'm also going to listen to the aorta, renal arteries, your iliacs, and the femorals. Now I'm going to be doing a little light palpations. No pain, tenderness. Okay. All right. I'm going to do the liver border. So I'm going to ask you to take a nice deep breath for me, and I'm going to use the mid-clavicular line to find the actual liver expansion. I'm going to go ahead and mark that area. Go ahead and take a deep breath and breathe. Okay. All right, I'm going to have you take another deep breath and hold. Okay, and I'm going to mark, breathe, And then I'm going to mark this area between 12 and 6 centimeters. I'm sorry, 12 to 6 centimeters. Very good. And we're going to go to the deeper palpation, so let me know. Any pain? Costal margins are noted. No pain?
No pain.
Okay. All right. And I'm going to check out your right costovertebral angle of the liver. And we're going to palpate. Okay. And we're going to go over to the spleen. On the left costal. Spleen should not be noted. And if it is, there could be some disease process going on. I'm going to be checking out your kidney. Kidneys also should not be noted. Okay. No problems there.
No.
Okay. And then the percussing of the spleen should be noted for the dullness, hollow sound. Okay. And then the last, I'm going to check your aorta pulsations. All right. Okay. And I'm going to have you sit forward. And I'm going to check out your legs. Also too. No swelling. Masses or lesions. Skin color and temperature is good. Feeling for your popliteal artery. And the other. Okay. Post-tibial. Okay. Dorsalis pedis. Post-tibial. And the dorsalis pedis. Okay, I'm going to ask you to lift up your feet for me and use them as a car. Pushing pressure, pressure, pressure. Good, good, nice and strong, nice and strong. We're going to do your reflexes. Okay. I'm going to check, I'm going to go this way, and we'll check your Achilles tendon first. Okay. Okay. I'm going to go to the knee. The opposite knee. Okay. And then we're going to go to brachio. Okay. And then the brachio. Okay, great. Before I end this, I'm going to ask you to open your mouth and stick out your tongue and move it up and down, side to side. Okay. And then I'm going to put this, go ahead and stick out, and I'm going to be looking at the lateral sides. Okay. No masses, lesions. Also be checking for your lateral apparatus, making sure that there's no masses or swelling. Also, I'm going to have you look at my nose and roll your eyes up and down, side to side. Okay. And go ahead and open up. Conjunctiva is pink. No yellow noted. Pupils are equal and color's good. Eyelashes and eyebrows are intact. And this ends my presentation. Thank you.